We will call the July 8th meeting of the Caroline County Board of Supervisors to order. As a special note, our meetings are usually on Tuesday, but we moved this one about 3 weeks ago because one of the board members couldn't make Tuesday. All board members are here. Mr. Jeff Black, representing Western Caroline. Mr. Jeff Seeley, representing Bowling Green. Mr. Reggie Underwood, representing Reedy Church. Wayne Akers, representing Madison. Calvin Taylor, representing Port Royal. And I'm Floyd Thomas, representing Mattapanai. I'm going to ask Mr. Taylor if he would lead us in an invocation.
Yes. Could we rise for the invocation, please? Heavenly Father, we come to thee at this hour thanking thee for the blessings that thou hast given us. We thank thee for this opportunity today to meet and to discuss those things that prove to be beneficial to the citizens of this county. We ask for wisdom and guidance, and in all things we give you the praise. This is in the name of Jesus Christ our Lord. Amen.
Amen. Please join us for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. At this point, we have opening board comments. Mr. Black.
None at this time.
Mr. Seeley.
Mr. Chairman, I would like to thank everybody that came to the Port Royal 4th of July, Mr. Taylor's district, but I will say that I took a number of pictures every year, and the pictures this year, over the last 3 or 4 years, the number of folks that attend is absolutely amazing, and it absolutely shows that it's growing, and I just want to say thanks to all the folks that came and for all the folks that helped set up and made that day happen. Thank you, Mr. Chairman.
Thank you, Mr. Seeley. Mr. Underwood.
Just a couple, Mr. Chairman. On Friday, July 5th, Luther Morris, one of our supervisors, ex-supervisor who served on this board, was funeralized in Ashland. Luther served on this board from 72 to 83 and again back from 84 to 91. Knowing he was one of the first black elected circuit court clerks in the Commonwealth of Virginia, certainly he was a trailblazer. Certainly Luther cared about the Reedy Church community and specifically did all he could to work within the Dawn community. Certainly he's going to be missed by the community, and I'm asking this board to draw up a resolution and present it to his wife on behalf of this board, acknowledging his accomplishments and service to the community and to this board.
Thank you, Mr. Underwood. Mr. Akers?
No, I have a comment.
Mr. Taylor?
I have none.
Okay, I have a few. I guess I've saved them up since we haven't met for almost 3 weeks, but I don't see Mr. Manster, the town manager from Bowling Green. I want to thank Mr. Manster for his help. He said he just made a phone call. He didn't do anything big, but his help in maintaining the dental clinic, and I understand we're going to talk about that a little while later, but I want to thank him. Also, on the passing of Mr. Morris, as Mr. Underwood stated, former supervisor, I'm going to ask the board to go along with your idea of putting a portrait of him in the circuit court. We'll get the portrait commissioned via the county. We'll have to ask, of course, permission from the judge that's coming, but I think there's plenty of space there, and that would be fairly appropriate since he served as clerk of the court. Then I've got an issue for traffic enforcement. If you could have the sheriff look at Carmel Church Loop and Ruther Glen Road. Apparently the trucks that are going through there the radius is either too tight or whatever, but they're running into the other lanes, and I got a call from someone who's going to speak later about that during the rezoning, but we need to check with them, with the sheriff, maybe VDOT for better signage, or fix the curb. And we all forgot to mention the McDonald's groundbreaking, which was one of the best ones I've ever been to. I think these are going to be some great people. They did wonderful things when they came here. They donated $500 to Fire and Rescue, $500 to the YMCA as their hello, welcome to Caroline. So I think that's going to be great. And my last one is kind of personal because as of yesterday. I've got a personal connection to Afghanistan. But I wanted to ask Private First Class, Trevor Parker, if he will come forward, please. Now, as Private Parker works his way down, his father-in-law put up a fairly large sign in his yard, and we won't do anything about signage and ordinances, but the sign said, "Welcome home, Trevor Parker from Afghanistan." And I rode by that sign, and as the 4th of July went by, I said, we need to make sure we recognize all of our returning veterans. So I wanted you to come, stand right there, and just listen to this for a minute. I don't let people clap in the board meetings, but I think you deserve that. So I'm going to ask you, Mark, did you get a picture? We're going to get some more. If you would come forward, Mrs. Parker, would you like to come forward too? And if your father and the little one would like to come forward, that would be great too. Let's bring the whole family down. I've already pre-tested the baby. She likes me. I think I'm okay. Come on down too. Now, if you folks will come up on stage. You can come either way. There's stairs on the end. We're going to use the American flag. All right. Come on over. Again, thank you so much. We're going to use the American flag. Wayne, just so you know, he's president.
Oh, super, great.
I'm not holding that again.
I think Joe probably is too.
The whole family is, even this one. Okay. Oh, is that a touch? All right, now, we want to take a picture with you guys. I'm going to stand here back, but we're going to put this on the county website. Another thank you. Mark's going to arrange it several times. Mark? Got the flag. Okay. Okay. Now let us all take a step forward, Mark, and the rest of the board come in. Yeah, I figured you somewhere. All right, Mark's very particular about his photographs, so we're going to make sure everybody looks good. Mark, you are going to Photoshop him. She has more hair. Me too. All right, we're all here. Can we swing it around to my right? Keep your same places. All right, we might as well stay where we are. Mrs. Harris, you live in the Bowling Green district, don't you? Keeley's going to read something for you as Mr. Collins walks his way up to the podium. Mr. Collins? Mr. Collins, can you come up to the podium? Go ahead, Jeff.
A resolution of appreciation for Charlene Harris for her work on the Caroline Library Storytime program. Whereas Charlene Harris began her career with the Caroline County Library in 1994 as an assistant with the Ladysmith branch, and whereas in 1997 she began doing storytelling activities in Bowling Green and has continued to do so despite becoming assistant director in September 2000. And whereas for 6 weeks each summer, Mrs. Harris directs the library's summer programs, which include stories, activities, crafts, field trips for children ages 4 through 14, and whereas during the school year, Mrs. Harris reads to pre-K classes at Bowling Green Primary School and has read to an estimated 20,000 children during her career at the library. And whereas over the years, the Storytime program has delighted and entertained children throughout Caroline County and has helped to build the basis for reading and academic success. Now, therefore, be it resolved, the Caroline County Board of Supervisors hereby expresses its appreciation to Charlene Harris for her faithful work with the library Storytime program and the valuable contribution she has made to the children and the citizens of Caroline County. Please come forward, Mrs. Harris.
Now, Mr. Collins, you wanted to say something.
Yeah, I want to say that Charlene is Susan B. Anthony of Caroline County receiving the children of many lanes. I would say that black and yellow, red and white, they are precious in her sight. Charlene loves the children of Caroline County. What Charlene is doing today, the seed have been sown, but the flowers depend on how they're nurtured. What Charlene is doing today, those children, little children who are precious, will never forget it when they are grown. The adults here in this room can learn a lot from what's happening there. Had we had the same nurturing that Charlene is giving those children today, that will be the future of Caroline County, and she's helping to make it better. Thank you.
Thank you, Mr. Collins. Mrs. Harris, if you would come forward. Will you come on forward? I'll come again. Come on back. Where do we go first? Virginia flag. Okay. Virginia flag, you got a resolution. Do that. Second step forward by everybody. We're going to do next. Okay. That's it? That's it. Okay, okay, we're taking a step forward. Come on, guys. The rest of the board. We're good, Mark. Yes.
What do you want, Mark?
We're good.
Licking your lips?
Mr. Taylor, right to the edge of, that's right there, that's good. Okay, we've got it. Let me step forward. Okay, and to my left. There.
That was good.
We're going to put a ruler on the floor.
Yeah, we need a mark.
All right, I draw right here.
I like blank. Wait, I got to fix my hair.
One more, or a couple, and one more, and I'll let you go. Getting it over there?
Okay. Now, before you go, where are you from? Where are you from? No, where were you from? You said pop. I thought you were from the Midwest.
That's why she said.
Because when you said pop, I was like, that's Midwest.
Michigan. I went to Michigan State.
Okay. I just had to figure out where that pop came from. Okay. We're good, Charlene. Thank you for all you've done. Do appreciate it. I'm gonna walk you down here. Okay. All right, we had to do all the good stuff first. I actually skipped over amendments to the agenda, so understand from Mr. Cully, we're going to remove our second closed meeting, which is after item 12.
That is correct.
We need to get a chance to talk to Mr. Emerson before we take it off. We could always add it back. Oh, because of you. Thanks. The facts. Oh, the facts. Okay, so we're removing the second one. That's the only amendment. We also have something else. The day of service. The day of service. We got an email requesting a day of service, and I'll read it to the board if you want. It's in September, so we've got enough time for you to bring it back. Okay. Yeah, let's do that. Okay. The next one is the discussion of status of Caroline County Dental Clinic, and I sure am hoping that everything we read in the paper is true. Dr. Rossheim? Is everything we read in the paper true?
I think so.
Okay.
Yeah.
Well, good to see you, sir.
Yeah, good to see you. Is there a way to project this? Or?
Days coming up. And do you have audio on that?
No.
Okay.
No, just the slides. Mr. Chairman, members of the board, Mr. Cully, I want to thank you for inviting me here to talk about the Caroline County Health Department and the Caroline Dental Program. My name is Dr. Brooke Rossheim. I'm the Health Director of the Rappahannock Area Health District. And I'd like to start just first by going over a little population data. I thought this might be interesting, that you can see that back in 1990, the population in Caroline County was a little over 19,000, and the health district was about 170,000. And if we move forward by 22 years, the estimate by the Census Bureau is that Caroline is now at a little bit short of 29,000, and the health district has almost doubled to 337,000. So we've seen a fair amount of growth in both Caroline County and the health district as a whole. I won't go through everything on this slide, but I wanted to give you a sense of just the services that are provided by the Caroline County Health Department. We operate in many areas. We operate in maternity care, family planning, dental, immunization. The WIC program is run through the health department. Communicable disease. We evaluate patients with tuberculosis or those who are suspected of having tuberculosis. We provide medical consultation to individuals and healthcare providers about public health issues. We have environmental health services that we provide, and on-site and food. And actually, this list is not a complete list. I could probably go on another slide or two with things that we provide. I wanted to take a minute just to go through in a little bit more detail some of the areas that we operate in. With regard to communicable disease control, the health district and the Caroline Health Department provides surveillance, investigation, and implementation of controls for communicable diseases and also outbreaks of communicable diseases. So, for example, every winter there are outbreaks of influenza, And that's where the health department gets involved in terms of assessing the outbreak, recommending control measures regarding how to stop the outbreak, and we have, not unusual that we'll have outbreaks of other things like whooping cough, pertussis. So that's an area where we get involved. As I've noted before, we do serve as the public health consultants for both the medical community and for the general public if they have questions about public health issues. And that could range from everything from Lyme disease, from TB, to a whole variety of other illnesses. Emergency preparedness and response is an area that we devote a lot of attention to. We work with the county and the fire and rescue department on these issues. One issue that we're currently working on is local sheltering. Again, we serve as the public health consultant if there's a concern that a bioweapon has been used, that a chemical weapon may have been used, a radiologic device, or another area is if there is a really severe outbreak. So everybody probably remembers the pandemic of influenza in 2009, and the health department played a substantial role in that because we assess the outbreak, we respond to it. We do provide education and guidance for residents and community partners about emergency preparedness and response. And the other thing is that the health district houses the Rappahannock Medical Reserve Corps, and these are volunteers who assist in times of disaster. With regard to environmental health, we currently permit 65 food service establishments in Caroline County. We also do the permitting and approval of private wells and on-site sewage systems. We have a fair amount of interaction with animal issues, particularly animal rabies control and human rabies prevention. So we get, particularly during the summer, a fair amount of calls about animal bites or animal exposures, and people seek our guidance, and we provide it about how to respond to that, whether people need to be treated for a possible exposure to rabies or whether they're okay as is. Immunizations is another area that public health focuses on. We do provide immunizations for individuals of all ages, but the biggest group that we see is probably children. And we do offer all of the vaccines that are required and recommended for children. So examples would be the pertussis vaccine that everyone's familiar with, pneumonia vaccine, meningitis, many others. Just to give you an idea of the number served, in FY13, we provided immunizations to 473 unduplicated patients. So that's unique patients. And many individuals seek immunizations at the health department, at the Caroline Health Department, because they either can't afford the immunization somewhere else or because they don't have a regular provider, and so we provide that immunization. The other thing is that the world of vaccines is getting to be more and more complicated, and so we serve an educational role in terms of providing advice, guidance to healthcare providers on use of vaccines, because that is becoming a more complicated area. We do provide prenatal care to pregnant women. On average, between FY10 and FY13, we saw about 100 maternity patients per year and an average of about 295 visits per year. We do provide nurse case management for our maternity patients. We also provide car seats. We also provide mandated health education classes for daycare providers. And really the goal of our maternity program is to promote better pregnancy outcomes and healthy pregnancy outcomes for both the mother and the child. Now I'd like to turn to the dental program. This is a program that serves children ages 1 through 19, and about 95% of the district's dental patients have Medicaid, and that also holds true for Caroline County. And if you look at the unduplicated patient counts over the last 4 years, you can see that roughly it's in the 500 to 600 range. The most recent year, FY13, that just closed, 548 unique unduplicated patients. I wanted to show you the fiscal data for the dental program in Caroline. This is the last 4 years of fiscal data. I will note that the FY 2013 data is preliminary because the Commonwealth's accounting system hasn't closed it out just yet. That'll happen in the next, probably later this week or early next week. What you can see is that total expenditures run about $240,000 to $250,000. In FY, now you may look at FY11 and FY12 and you see that the expenditures are lower. For FY11 and FY12, we did not have a full-time dentist in both of those years for the entire fiscal year. That's why those numbers are a little lower. You can see that the dental clinic has operated at a loss for the last 4 fiscal years, ranging from about $40,000 to $50,000 or even more $1,000. The preliminary data for FY 2013 is that we will come in at a loss of about a little under $42,000. Previously, the health district was able to absorb the losses due to vacancy savings. And typically at the health district, our vacancy rate has been in the teens or sometimes even higher than that. And in 2013, the vacancy rate dropped to about 3%. And this was something that we did not expect. This was something that we were unable to anticipate. Since we did not have those vacancy savings, this forced us into a difficult budget situation. And we were faced with having to make some difficult budget decisions. And that's where the decision was made as far as closing the Caroline and the Rappahannock dental program. That was a decision that was not taken lightly as far as closing the dental program. It was one that we spent a lot of time going through. We certainly went to Richmond to consult with central office staff about this. So that was the sort of the genesis behind this. We are currently holding multiple positions open in the district to save money now. Having said all that, I do have some good news. We have been working with community partners regarding the dental program. As I'm sure you all know, Central Virginia Health Services has expressed its interest in taking over the dental clinic, and we are certainly in concurrence with that. And we are working with CVHS on the transfer process, and obviously we are hopeful that this will take place. Given the collaboration between the health district and CVHS, the health district has received permission from our central office to keep the Caroline Dental Clinic open through September 30, 2013. And this brings me to a couple of requests that I would put forward to the board. First of all, on behalf of the district, I would like to thank the board for its offer of $30,000 to defray the Caroline Dental losses for FY13. And the health district would like to obtain those funds. Based on historical revenue and expenditure data, keeping the dental clinic open from July 1 through September 30 will incur a loss of about $39,000. And that is because the summer months are slower. The kids are out of school, we don't have as many visits, and we went back and looked at our data to come up with that number. That's an estimate. Therefore, I would respectfully request that the board allow the Caroline Health Department to keep all the monies already budgeted to it for FY14, and this will allow the dental clinic to remain open through September 2013. And that's the end of my presentation, and I'd be happy to answer any questions you have.
Dr. Rossheim, thank you for that presentation. The first question is there something magical with the September 30th date? Is that the federal fiscal year end or Medicaid connection or something? Or?
No, we felt that it was enough time for Central Virginia Health Services to go through the process that it needs to go through. And this is Rod Manifold from Central Virginia Health Services. Okay. We wanted to give enough time for CVHS to go through its process with HRSA, their funder, their grantor, okay. And that's where the September 30th date came from.
I understand. So it's not, my first thought was, oh, it's open, but only till September 30th, but what you're saying is you're going to maintain it until September 30th, and then it'll transfer to another agency after that.
That is our goal.
Okay.
That is what we are hopeful for, yes.
And you're asking us to
allow us to keep the monies that have already been budgeted to the Caroline Health Department for FY14.
Okay.
Essentially not to take back any money.
How's this for a deal?
Yes, sir.
If you keep the health clinic open till September 30th and we get somebody else, we can probably go along with letting you keep the money.
Okay.
Fair?
Can you say that one more time, please?
He's already said that.
We're good. We're good. I think we're fine.
Okay, I just don't want to promise you something that I can't say for sure that this will happen. So I don't want to promise you something I can't deliver on.
Okay. Any other questions?
I guess I'm confused in letting you keep the 2014 budget. Can you explain that a little bit?
Plus $30,000 more.
Plus
That's
the
what I was saying.
30,000. I guess I'm confused from that.
Well, the 30,000 that you're willing to give us for FY13 will help defray the losses from FY13.
Okay, which was what our intent was.
Yes. And then we're projecting losses of at least 39,000 for the first 3 months of FY14. And so therefore, we would need that money in order to stay open.
If we don't give them that money, the money they're going to lose in 2014, this
right.
fiscal year now, they're going to be that much more short.
Yeah. And unfortunately, if we don't have that, I don't believe we would be able to stay open because it would just be too much. It would be too much of a loss for us to carry.
So what you're saying is if we don't give you the 30, you'll be short 69? The 30 plus 39? Or is it 30 and then it would be short 9,000? I saw a shortfall of 39,000.
39 was for this fiscal
39
year.
is for this fiscal year 14. It's for the first 3 months of fiscal 14.
14, okay.
Yeah, and that's just for the first 3 months of fiscal 14, and that's because the summer is always a slow period when there are not many patients seen, and so we're still paying all of our expenses, and so we typically would lose money during those months.
Could you reduce the hours of the dental clinic during the summer so that the loss isn't so much?
I suppose that's an idea that we could consider.
Be open 2 or 3 days a week instead of 5?
Go
And
ahead.
I guess my other question is, there are 2 different groups. You are from RA,
Yes, I'm sorry.
the Rappahannock Area Health Department.
I'm the health director at the health district, and the health district encompasses 5 localities, 5 health departments, and one of them is Caroline.
Okay, and then the gentleman behind you is from VDA?
He's from Central Virginia Health Services, which is
The people that run the clinic that we have now.
they operate Caroline Family Practice, and they operate the Community Health Center of the Rappahannock region in Fredericksburg.
Okay, that's what I was, so us giving you the ability for the 2014 money doesn't hurt them starting 1 September or 1 October?
1 October.
No, actually, it really helps it helps the continuity, because that way we wouldn't have to close, essentially, because that's what we're trying to do, is basically have a seamless transition where we don't have to close temporarily.
Right.
And then hopefully everything with HRSA will work out for Central Virginia Health Services, and then somewhere along the way, about September, then they would kind of take over. We would sort of kind of slide out of the picture then,
Now,
and it would be a seamless transition.
Now, just to make sure we're clear, you're going to be $39,000 short
We estimate
by at the end of September 30th.
Yes, sir.
Okay, we offered $30,000.
Yes.
Okay, we offered that at our June meeting, I believe, but it was for this fiscal year. So you're now only going to be $9,000 short.
No, we are. If I can go back, let me go back to the slide that shows you the.
So that was the 42.
That's the addition I was doing.
That's the 42 we have there, but you already lost that 42,000 because that year's gone.
Yes, that's correct. Let me.
Okay.
Yeah, let me show you the.
You don't want us to go back and pay for that 40,000. That year's over, right?
Right, but we would like to get the money, because that will help defray the losses that we've already incurred.
Oh, yeah, that's the. See, they already lost. What he's saying is they already lost 40,000.
We've already lost. Our estimate for
That's what I'm
FY13 is that we've already lost 41,488.
Right.
And so, we would like to get the 30,000 that y'all offered to help defray that loss.
Okay.
And then that's just FY13. That
Let's
doesn't.
just do the math. All right, the math is you lost 41,000,
Yes,
and you're going to lose another 39,000.
that's
So
correct.
you're going to lose net $80,000.
Roughly, yes.
And we are going to give you $30,000,
Right.
and you're going to be happy, right?
But you're going to allow us to keep the money budgeted already for FY14.
How much is that? How much is that?
Do you have that number, Ms. Hatcher? 108. $108,000. $308,000.
But how much is for the dental clinic?
Yeah.
About 30,000.
About 30,000 of that 300,000 is for the dental clinic?
Yeah.
So we're only going to give you $30,000, which is what we said we would do.
Right.
You're going to lose $80,000 between now and September 30th. Well, between June and September 30th, because you already lost 40, and you're going to lose another 39. But we're going to give you $30,000,
Yes.
and that's all we're going to give you.
Correct.
And you're going to keep the money we already budgeted
Yes.
for your program.
Yes. Those are
Okay.
the two requests.
So we're basically giving you $30,000 in that original budget, and we're giving you another $30,000. So we're going to end up giving you $60,000 total, which is really what you're going to. I mean, you're going to get 30 anyhow.
Yeah. I mean, yes.
Okay. So we're giving you 60 total to stay till September, basically. But we're
Yes.
only giving them an additional 30.
Yes.
I guess my question is, what happens? I mean, you said for the first quarter of next year, you anticipate losing 39,000.
Yes.
Do you have any projections for the second quarter?
Well, we would hopefully by that time we would have transitioned to Central Virginia Health Services.
Okay.
So CVHS would, the process that, in terms of CVHS going to increase their scope of service, that they would take over, and then it would be CVHS's, it would be their dental program.
Okay.
Is there, I guess my question maybe for the gentleman behind you
That's,
is,
yeah.
I mean, is that going to be another 39,000 in the next quarter after that?
You want to step up and.
I can talk to you about whatever
I think it's your turn, because I think we need to make sure we understand after the transition, and I understand you've got some Medicaid ways to fund it, so we won't be in this position in 6 months. Would you please step forward and say that?
My name is Rod Manifold. I'm Executive Director of Central Virginia Health Services. In addition to the Caroline Family Practice, we also operate 13 other community health centers around Central Virginia, surrounding Richmond and all the way to Westmoreland. As many of you are aware, Fredericksburg and Caroline and King William are the ones that we operate in this general area. Thanks for the chance to speak tonight. What we would like to do is take over the practice as it is, and perhaps we will do some expansion over the course of the next few years. That is, that we would be able to offer a fuller program in the summer, perhaps, and so on. We already operate one dental program in the community at the Caroline Family Practice, and it serves both adults, mostly adults, and children. This program we would retain as a children's dental program. Because of the magic that you have in this community of the school system and social services and the county itself and the health district, all those pieces falling into place means that we'll have equipment provided by the health district. They'll continue to provide and leave the equipment where it is, that the space would be available from you, the county, where it's presently being held, that the school system, that social service will continue to help get children into the Medicaid program who are eligible, and then that the school system will continue to transport children during the school day to the program. All these pieces in place that you already know about are what makes us want to do this and capable of doing this. We do get some enhanced Medicaid revenue as well, more than the health department gets per visit. It's part of what Congress has granted us. So we will have that additional revenue. We're going to come back to you in the coming month or two as we go through our process, which I'll just explain very briefly in a moment. But we're going to come back to you and ask you if you would be able to give us free rent at this space that you're currently in. You are, there is a calculation of rent that the health district pays the county for the space that they're in now, and we'd like to have that. We'd like to request that being given for probably 2 or 3 years while we get the thing going. We may want to ask for some additional money. I don't want to promise that I won't ask for additional money, but I can pretty well tell you that it won't be $30,000 in cash. We will not need that to run this program. Let me say what we have to do and why Dr. Rossheim has really, I consider it to be a wonderful offer to continue to do this, although I recognize the cost factor to you. But we have about a 60-day process that we have to go through. HRSA funds us. About 30% of our annual budget comes from a HRSA grant. And in exchange for that, as all of you know, there are some pretty strong strings attached to how we operate. One of those strings is that we have a board of directors that at least 51% of them are patients in our practice. Stephen Manster is our board representative here, one of our patients. And by the way, that call he made that you mentioned was to me. It was a very important call. He called a meeting, made more than one because there were several of us there. But that was an important call because when my bosses call, I answer and I respond, and he's one of my 15 bosses. So we're very happy to work on this. We must go through about a 60-day process, probably no less than that, wherein we ask HRSA to grant us the ability to change our scope of practice or our scope of service to add another site. That would be this dental site. And that is the key to this, is asking them. We have to fill out some forms that are online, it takes them about 60 days to respond.